Ramadan is the holy month in the Muslim calendar in which Quran was revealed to Prophet Muhammad, be peace upon him, as a guide to mankind and also guidance and judgment between the right and the wrong. So every one of us who is present at home during this holy month should spend it in fasting. The purpose of fasting is to develop God consciousness, self-control, improvement of health by reducing and eliminating impurities from the body, and to become aware of the plight of the poor, the hungry and the sick. Ramadan is the month of spiritual consciousness and high sense of social responsibility.
يا أيها الذين آمنوا كتب عليكم الصيام كما كتب على الذين من قبلكم لعلكم تتقون.
The word Ramadan derives from the Arabic root Ramida or Ar-Ramad, meaning scorching heat or dryness. It is in this month, in the year 620 of the Christian era, that the Qur'an was first revealed to the Prophet Muhammad, peace be upon him, and later the instruction for all able Muslims to spend it in fast. The fourth pillar of Islam, fasting during Ramadan, is obligatory on all Muslims over the age of puberty, with the exception of those who are ill or whose health prevents it. Spiritual aspects include refraining from gossiping, lying, slandering, and all traits of bad character. Purity of thought and action is paramount. Time should be spent in spiritual reflection, prayer, doing good deeds, and spending time with the family and friends. By doing this, the act of fasting redirects the heart away from worldly activities towards the divine. It is for this reason that Muslims spend Ramadan in increased prayer, such as the Taraweeh or night prayers, which take place late into the night and involve the recitation of large chapters of the Qur'an, reading of the Qur'an, and making dua or supplication to God. Accordingly, let's beg for Allah's mercy, His forgiveness and salvation from the hellfire. As well as benefiting Muslims spiritually, many scientists believe that fasting could be extremely beneficial to health. The body's metabolic rate slows during the fast, allowing it to conserve energy, thereby contributing to the healing process, and the value of fasting as a treatment for many chronic health conditions continues to be studied. In addition to weight loss and healthy weight maintenance, fasting has been linked to improved immune system function, lower systolic blood pressure, lower body temperature, lower cholesterol, and lowering of the glucose levels in the blood. It may contribute to longer life by cleaning the body of harmful toxins. The month of Ramadan is a great opportunity to focus on a balanced and healthy lifestyle. Through fasting, you learn how to manage your eating habits and improve self-discipline.
Amongst many other things, fasting must serve the purpose of self-control and self-discipline. Thus, while stop eating, drinking and smoking from dawn to dusk, that is the daytime, it's imperative that we must discipline ourselves in our diet, which is allowed from dusk to dawn, that's the night time.
In Ramadan, people tend to eat a lot of rich foods, which tends to cause discomfort and lead to indigestion. Our diet in Ramadan should not differ very much from our normal diet and should be as simple as possible. Make sure that your meals contain major food groups such as bread, cereals, milk and dairy products, fish, meat and poultry. Sahur. In view of the long hours of fasting, we should consume the so-called complex carbohydrates or slow digesting foods at sahur so that the food lasts longer, about 8 hours, making you less hungry during the day. Such foods include grains and seeds like barley, wheat, oats, millet, semolina, beans, lentils, wholemeal flour and unpolished rice. Iftar. In contrast, refined carbohydrates of fast digesting foods last for only 3 to 4 hours and may be better taken at iftar to rapidly restore blood glucose levels. Fast burning foods include foods that contain sugar and white flour. Dates are an excellent source of sugar, fiber, carbohydrates, potassium and magnesium and have been recommended since the days of the Prophet Muhammad, peace be upon him, as a good way of breaking the fast. Fried foods, very spicy foods and foods containing too much sugar such as sweets can cause health problems and should be limited during Ramadan. They cause indigestion, heartburn and weight problems.
Long periods of fasting, especially during summer heat, can cause considerable water loss and may affect glucose metabolism, leading to dehydration and hypoglycemia. Children, elderly people, pregnant women, frail, weak and underweight, and persons with underlying medical conditions are prone to develop dehydration and hypoglycemia.
One should drink enough of water, especially at suhoor, and limit intake of caffeine-containing beverages, namely tea and coffee. Caffeine is a diuretic and will not provide adequate hydration. Direct exposure to sun, physical labor, or exercise in open and during late afternoon should be avoided. It is recommended that everyone engage in some kind of light exercise such as stretching or walking. It's important to follow good time management practices for prayer and other religious activities, sleep, studies, job, and physical activities or exercise.
Every year, I spend several weeks prior to Ramadan in counseling my patients about the safety of their observance of fast and any special precautions they need to take in diet, medication and lifestyle to observe the fast. In this video, I shall give you an overview of how I advise my patients on observance of fast, keeping in mind strictly the essence of the Holy Quranic verses.
شهر رمضان الذي أنزل فيه القرآن هدى للناس وبينات من الهدى والفرقان فمن شهد منكم الشهر فليصم ومن كان مريضا أو على سفر فعدة من أيام أخر يريد الله بكم اليسر ولا يريد بكم العسر ولتكملوا العدة ولتكبروا الله على ما هداكم ولعلكم تشكرون.
during the month of Ramadan, those with disease need counseling about the safety of their observance of fast and any special precaution they need in diet, medication and lifestyle to observe fast. Acute illnesses, which make patients pretty sick, need a strong advice against fast for the period of their illness and the recovery period thereafter. Once the patient recovers fully from his acute illness and can sustain effects of fasting, he can be advised to observe fast and make up the days lost by him. Patients to be included in this category can be left to the discretion of the physician. The criteria should be that fasting and its implications, that is restricted diet, restricted water intake, inability to administer medication for over 12 hours, etc., influence adversely recovery from illness or affect outcome of illness.
During the past 2 decades, a better understanding of the pathophysiological changes during Ramadan fasting in healthy and diabetic patients has provided few guidelines as how to advise diabetic patients who want to fast. Hemoglobin A1C values, an important parameter to assess control of metabolic state of diabetes, showed no change or even improved during Ramadan. Physicians should advise diabetic patients against fasting under following conditions. Fasting should be encouraged in diabetics who are overweight and on oral anti-diabetic pills or diet advice alone. During fasting, diabetics should be advised on assessment of physical well-being, assessment of metabolic control of diabetes, adjustment of diet protocol for Ramadan fasting, adjustment of drug regimens, especially change of long-acting hypoglycemic drugs to short-acting drugs to prevent hypoglycemia, especially in the late afternoon. They should also be encouraged for continued proper physical activity, recognition of warning signs of dehydration, hypoglycemia, and other possible complications of diabetes. Patients on insulin should perform blood glucose before sahur, that is the pre-dawn meal, to adjust the insulin dosage and prevent hypoglycemia and postprandial hyperglycemia following overeating.
Home blood glucose monitoring should be performed just before the iftar, that is the sunset meal, and 3 hours afterwards. If a diabetic who is on insulin therapy chooses to observe fast, insulin therapy needs to be readjusted either as 3-dose insulin regimen, that is 2 doses before meals, sunset and dawn, and 1 dose in the late evening of intermediate acting insulin, or 2-dose insulin regimen, that is evening insulin combined with short acting and medium acting insulin equivalent to the previous morning dosage. Regarding oral medication, half the dose can be taken before sahur and half immediately after iftar. Diabetics must be reminded to abstain from the high-calorie and highly refined foods prepared during this month.
Patients suffering from mild to moderate hypertension should be encouraged to fast as it may help control of blood pressure. It is advisable to use sustained release drug formulations whose effect can last throughout the fasting period. Patients with severe uncontrolled hypertension, unstable heart disease or those who have complications like renal failure, recent stroke, or heart failure should be advised against fasting, as such patients need acute life-saving treatment, and fasting can impede disease recovery and influence adversely disease outcome.
Fasting and migraine. People with uncontrolled, frequently occurring migraine or cluster headaches should be advised against fasting, as fasting may worsen migraine and interfere in managing acute attacks. However, if migraine is well controlled and attacks are infrequent, fast may be allowed under supervision. Fasting and pregnancy. There is medical evidence to show that fasting in pregnancy is not a good idea. If a pregnant woman feels strongly, is healthy enough to fast, she may do so, especially during the early part of the pregnancy. If she doesn't feel well enough to fast, Islamic law gives her clear permission not to fast and to make up the missed fasts later. Fasting in patients with renal failure and on dialysis. People with renal failure must not fast. Hemodialysis is performed about 3 times a week and causes significant shifts of fluids and salts within the body. Such patients must not fast and should perform fidya. Fasting and peptic ulcer disease.
Patients with acute ulcer disease cannot fast till ulcer heals, and any precipitating cause of ulcer like Helicobacter pylori infection is eradicated or ulcerogenic drugs are withdrawn. Patients with silent ulcers or those who have had bleeds from ulcers should not fast, as it may precipitate another bleed or can cause ulcer perforation. Heartburn, which is a symptom of acid reflux into the food pipe, may worsen during the fast, and advice on such patients can be individualized. Many such patients may fast with no problems if symptoms are controlled with acid reducing pill, especially taken in the morning.
Patients with gas, irritable bowel syndrome, altered bowel habits and dyspepsia, that is presenting as bloating or indigestion, can be allowed to fast safely, and symptoms in such patients regress during the fast period. Patients with chronic eventful illnesses like Crohn's disease should not fast while the disease is on active medication and remission is yet to occur. Patients with chronic liver diseases which are stable impose no added risk with fasting. However, chronic liver disease which shows signs of liver failure may worsen with fast, and such patients need advice accordingly. Fasting and modification of drug dose and therapy.
Drug administration and dosage is a complex issue, and physicians need considerable information on modifying drug dosage and frequency during fasting. It is advisable that physicians take advice from pharmacy services or refer to literature on advising patients on drug therapy during fasting. One of the major problems occurs once patient stops medication during fasting. I wish whole Muslim Ummah a healthy and a happy Ramadan. Ramadan Kareem.